wanted to go over just a few of the highlights of Chapter 1 with you. Chapter 1 talks about the art and the science of nursing, and we had already talked about that as far as nursing in 305, but it's the same for mental health nursing as well. The art of the nursing, that is our caring, our attending, and our patient advocacies, and your book gives a lot of really good examples of how we can go about showing caring behaviors and what are some examples of advocacy for our patients. For instance, the right to have all the information so they can make an informed decision and so forth. So that's the caring portion. The science portion is embedded with evidence-based practice. And if that was an area that you did not do well on in the 305 class, you really are going to have to go back and review and try to get a good grasp of what evidence-based practice is. With mental health, we don't have as much research as we need, so we use the best evidence that we can find, and there is a hierarchy pyramid that's in your book that is really good, that shows us what is the best type of evidence that we need to use. But along with the evidence, we're going to use clinical expertise to help us make those decisions as far as how we're going to implement evidence-based practice into our clinical practice. I want to make sure that you understand the 5 A's of integrating evidence-based practice, and that we understand that the patient's preference actually is a big part of that as well. Let me just take a quick look here and see if there's anything else that we need to talk about. Yeah, I've posted 2 videos for you. One is on the recovery model, and one is on trauma-informed care. Those are really good, and it goes right along with what your book talks about. So I want you to go and look at those as well. I need for you to be very familiar with QSEN, Quality Safety Education for Nurses, and the 6 standards that QSEN incorporates: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. All of those concepts that we learned in 305, you're going to see those again over and over forever. That's all I can say. But I want you to understand, I think your book on page 3 talks about a systematic review or a meta-analysis of randomized controlled studies and evidence-based clinical practice guidelines, that they provide the strongest evidence on which to base the clinical practice. So again, I gave you a little video explaining how you need to use your textbook. So if you can understand these key terms, and if you can answer the objectives and you have a good understanding of that, and you look at the key points you've read, and you can apply, that's why that applying critical judgment section is really valuable. So just make sure you're using your book correctly and that you understand. If you have any questions, you'll need to let me know so that we can get those answered as soon as possible. Okay, that's it for Chapter 1.